The thyroid is a small butterfly-shaped endocrine gland located in the anterior region of the neck, in front of the trachea and larynx. Its main function is to secrete thyroid hormones, which are fundamental for the correct performance of numerous functions of our organism, including the regulation of metabolism, body temperature, and heartbeat. Not only that, it also guarantees the development of the central nervous system and body growth, as well as influencing sexual health, the menstrual cycle, and therefore fertility. In the last video, which you can find by clicking above, we saw some of the signals that the body sends us when the thyroid is not functioning correctly. For example, in the case of hypothyroidism and hyperthyroidism, the two most frequent conditions affecting the endocrine gland. The thyroid can also undergo some tumor processes due to the anomalous and uncontrolled growth of the cells that constitute it, thus giving rise to the formation of a tumor mass, which can be benign or malignant. Incidence and types of thyroid cancer. According to the latest data provided by the Italian Association of Medical Oncology, approximately 12,200 diagnoses of thyroid cancer were estimated in 2022, of which 3,500 in men and 8,700 in women. Thyroid cancer represents 3–4% of all tumors, highlighting a greater incidence in females, which is approximately 2/4 times higher than in males. In recent years, there has been an increase in the number of cases of thyroid cancer, but the explanation seems to be attributed to the intensification of screening programs and the improvement of ultrasound diagnostic techniques, which allow the identification of small tumors, which in the past did not. They were discovered. There are different types of thyroid cancer. The most frequent one is the well-differentiated form, papillary and follicular, which represents 85–90% of cases, followed by the medullary form, 5–7%, and finally the anaplastic form, approximately 1% of cases. But what are the most frequent signs and symptoms of thyroid cancer? Let's go see them. Thyroid nodule. The most common sign of thyroid cancer is the formation of a thyroid nodule, solid, liquid, or mixed formation that forms inside the thyroid gland and can have variable dimensions, ranging from a few millimeters in diameter up to several centimeters. Thyroid nodules are divided into three categories: hot, cold, and warm, depending on their ability to produce hormones or not. Hot nodules are more active than normal thyroid tissue and therefore produce more thyroid hormones, favoring the onset of hyperthyroidism. They are generally benign and do not require any type of treatment, but only ultrasound monitoring at predetermined intervals. Cold nodules, on the other hand, are made up of little or no active tissue, and in addition to appearing in the case of hypothyroidism, they deserve further cytological investigation, as they have a greater tendency to have a malignant nature compared to hot nodules. Warm or isocaptance nodules represent the majority of thyroid nodules and are characterized by normally functioning tissue, but this does not completely exclude the risk of them being malignant. In the majority of cases, thyroid nodules are benign. That is, they do not alter the functionality of the thyroid and do not cause any symptoms. In fact, it is no coincidence that they are generally discovered accidentally during a medical examination performed for other reasons. The remaining 5–10% of thyroid nodules, however, are malignant and therefore indicative of thyroid cancer. As the Italian Association for Cancer Research reminds, the presence of nodules, whether benign or malignant, almost never alter thyroid function, and often the patient does not experience any specific disorder. However, if they increase in size over time, they can create a swelling at the base of the neck, causing shortness of breath and difficulty swallowing. Goiter. The term goiter refers to a pathological enlargement of the thyroid and is classified as diffuse or nodular. In the first case, the volumetric increase affects the entire thyroid gland and does not present nodular alterations, while in the second case, one or more nodules develop within the thyroid. The most common cause of goiter worldwide is nutritional iodine deficiency, an essential micronutrient for human growth and development, as well as an essential component of thyroid hormones necessary for proper thyroid function. In some cases, however, thyroid goiter is due to thyroid cancer, which causes an enlargement of the gland. Thus, a more or less evident swelling is noticed at the base of the neck, which tends to move up and down when swallowing. As the tumor mass increases in size, the swelling begins to be more and more visible to the naked eye, becoming not only a possible aesthetic problem, but also a health one. This is because the goiter exerts increasing pressure and compression on adjacent structures, including the esophagus, trachea, and larynx. In the first case, dysphagia occurs, a dysfunction of the digestive system, in which there is difficulty swallowing solid, liquid, or semi-liquid foods. This gives the sensation that the ingested food remains halfway between the mouth and the stomach, often associated with coughing, vomiting, and a feeling of suffocation. The enlargement of the thyroid can compress the trachea and cause dyspnea, also known as air hunger or shortness of breath. It is a medical condition in which breathing appears labored, painful, and forced, thus having the sensation of lack of air or of not being able to get a sufficient amount of it into the lungs. Goiter can also cause dysphonia, that is an alteration of the voice from both a qualitative and quantitative point of view. This is because the tumor mass can compress the laryngeal nerves that control the functioning of the vocal cords. Hyperthyroidism and hypothyroidism. When the production of thyroid hormones is altered, we speak of hypothyroidism and hyperthyroidism. Hypothyroidism, also called underactive thyroid, occurs when the thyroid gland does not produce a sufficient quantity of thyroid hormones to satisfy all the body's needs, thus resulting in a slowdown of all metabolic processes. In the case of hyperthyroidism, however, also called overactive thyroid, the thyroid gland secretes an excessive quantity of thyroid hormones, causing an acceleration of metabolic processes. These are therefore two opposite pathological conditions which manifest themselves with different symptoms, but which are unlikely to be due to a thyroid tumor, as it rarely influences the production of thyroid hormones. In fact, thyroid cancer is usually found in a euthyroid patient, that is one who has normal thyroid function, where thyroid hormones are present in physiological. In some cases, however, the onset of symptoms associated with hyperthyroidism or hypothyroidism can be caused by the development of primary or metastatic thyroid cancer. Enlargement of the lateral cervical lymph nodes. Lymphatic glands, also known as lymph nodes, are small bean-shaped glands that have the task of filtering the lymph they receive from the lymphatic vessels to remove any foreign substances, germs, or neoplastic cells. The lateral cervical lymph nodes, as the name suggests, are a group of lymph nodes located in the lateral part of the neck and which under certain conditions can become enlarged. In most cases, the cause is a viral or bacterial infection, such as the common cold, while in other cases, they can be the consequence of an autoimmune disease or a tumor. Thyroid cancer, for example, can manifest itself as a thyroid nodule found on palpation or during a thyroid ultrasound, sometimes associated with swollen lymph nodes in the neck. This is because the immune system recognizes the malignant neoplasm and tries to destroy the tumor cells, increasing the production of lymphocytes, which will end up accumulating inside the lymph nodes. In most cases, thyroid tumors grow very slowly and are not very aggressive, so much so that they often remain silent, without showing signs for many years. In fact, it has been estimated that up to 10–15% of the thyroids examined during autopsy may present tumor forms that were not diagnosed when the person was alive. Thyroid cancer generally has a very favorable prognosis, particularly in well-differentiated forms, reaching a survival rate of 90% 10–15 years after diagnosis.